The pace of change is increasing in healthcare. Small hospital systems are merging with larger systems simply because they cannot afford, nor do they have the capacity to install, implement, and support complex applications like Epic. Entire affiliate strategies are also being driven in part by the capabilities of Epic. Systems architecture is making a difference as Epic becomes available to a hospital's customers, their patients, their affiliates, and other aligned organizations. Architecture makes a difference.
At the macro level, architecture supports the larger initiatives of the healthcare system. And really, IT is moving from being a supporting cast member to being a lead actor in this play, as healthcare is increasingly dependent upon IT to provide innovation. When we look at the market today, at the macro level, the strategic level in healthcare, we see some mergers and acquisitions being driven by the inability of small hospitals to implement the systems necessary to meet meaningful use criteria. There's a real question in the industry as to whether or not the 50 to 100 bed rural hospital will continue to exist as a standalone entity, in part because of the cost and complexity of managing these complex enterprise applications. As a result, the IT infrastructure that you put in place has to be able to support the flexible and innovative issues of the market. You have to be able to support the M&A activity that your CEO may drop on you as the CIO. You may have to support rapid growth. In fact, your affiliate strategy may be driven by giving access to your physicians for this clinical system that you're implementing internally. As a result, issues of high availability, disaster recovery, data integrity, backup and recovery take on a whole new level of seriousness in your environment, because downtime is simply not an option. Because now, instead of impacting a paper-oriented workflow, you're now impacting an electronically enabled workflow that extends beyond the geographic boundaries of your hospital to all of your affiliates, your associated clinics, and perhaps even other healthcare agencies. And so at the micro level, strong systems architecture provides the ability for a clinical experience for the physicians that use your system. And those are complex problems, and OST knows how to solve those problems. At the macro level, a flexible IT infrastructure that has extraordinary availability and exceptional performance helps meet the needs for flexibility, agility, and innovation that the health system needs in today's healthcare market. And those are complex problems, and OST knows how to solve those too.
At Metro Health, OST utilized a common low-cost platform to deliver Epic high availability at a remarkably low price point. The solution provided greater administrative flexibility for IT. It delivered higher service levels for the hospital and reduced planned downtime for routine administration. OST also designed, implemented, and tested a resilient enterprise-wide disaster recovery solution to meet Epic requirements. By tying together Epic servers with a larger IT environment and storage, the technology with Epic is dependent, like PSCS images, Epic BLOB, and user home folders, can be incorporated into a high availability, disaster tolerant solution. Clients can be certain that all services are available during any major IT event. OST has experience in client infrastructure, printing, storage, Unix and Windows infrastructure necessary for Epic environments to support production, high availability, and disaster recovery solutions. All of these pieces need to be designed and integrated for an optimal Epic ecosystem. As an employee-owned company, our people are invested in your success in a way that is distinct from typical hardware resellers. To learn how OST can help with your Epic Systems environment, please call Dave Speaker